So parents often would like to know how you can tell the difference between moodiness and depression in your children and teenagers. One of the main differences is that moodiness tends to be in response to a specific trigger and tends to be pretty short-lived, and it does not interfere with functioning. Depression is more chronic, it's more pervasive, so someone might be having feelings of sadness for the majority of the day for several days or weeks in a row. And the biggest part of it is that the symptoms really do get in the way of day-to-day life. Parents should begin to have a heightened sense of concern about depression when they start seeing major changes in how their children handle and deal with day-to-day challenges. When you start noticing that your child is not behaving in ways that they typically would behave, perhaps they're acting out more, maybe they're withdrawing more, losing interest in things that they used to really enjoy, those are all signs that it might be time to really seek some help. If you are concerned that your child might be suffering from depression, one of the first steps would be to consult with your pediatrician or family doctor, and they can help guide you to the next step, which might either include therapy or meeting with a psychiatrist for a psychiatric evaluation. One of the most serious symptoms of depression is suicidal thoughts. If you have concerns that your child is experiencing suicidal thoughts, the first thing to know is that it's okay to talk to them about it. It's okay to ask your child if they are having thoughts like that. Sometimes parents feel that if they bring it up or if they ask, that they're putting the thought into their child's head, but this has been shown not to be true. If you do think that your child is having suicidal thoughts, it is important that you take immediate action. And this can look like, if it's during business hours, you might try calling your primary care doctor, your pediatrician. At any time, though, you can go to your closest emergency room. If you're a parent of a child with depression, there are definitely things that you can do at home to help them. The first really is to talk to them and to listen in a very active, attentive way. Let them know that they have your full attention. You want to listen with compassion and empathy. You can help them develop kind of a safety plan or a plan of action. So you might help them figure out what coping skills they might use, what helps them to feel better, which could be listening to music or journaling or art. It's important to encourage your kids to get a lot of physical activity. Exercise is definitely very helpful for depression for children as well as for adults. Getting some sunshine also can just be a very helpful thing for kids. There are multiple ways to treat depression. One avenue that people can take is therapy, and therapy can include cognitive behavioral therapy, interpersonal therapy, and then there are other types of supportive therapies that also can be helpful. Often in conjunction with therapy, children and teenagers might be prescribed medication. And this can be prescribed either by pediatricians, family doctors, or psychiatrists.